Hello everyone, before we get started, don't forget to subscribe. Click on that notification bell. Like, dislike, comment, share. Please let us know what you're thinking. Also, you can follow us on Spotify, Apple Podcasts, and wherever you get your podcasts. Now, today, on the Angel of Words podcast, we have healthcare guru, Miss Lori Marie Riley, on deck on the Angel of Words podcast. Hello, everyone, and welcome to another edition of the Angel of Words podcast. I am your host, Angel of Words, and today we have someone very near and dear to me, the healthcare guru, Lori Marie Riley, who's an account executive for employee health benefits for one of the top brokerage firms in Dallas, Texas. Miss Riley, thank you for joining us today on the Angel of Words podcast. It's a pleasure to have you.
Thank you so much, Angel. I'm so proud of you.
Oh, thank you so much, big sis. And by the way, everyone, this is my my middle child counterpart, Miss Lori Riley. Thank you for being here. Now, Miss Riley, 20 million people supposedly may lose their health insurance, and I'm one of those people that may lose not only his health insurance but his 9 to 5 because if they terminate the Affordable Care Act. You're the health insurance guru. You know, I brought you on the podcast because I want you to let us know what other options may be available to us if this were to happen. And that's why I'm so thankful that you were able to spend some time with us here today on the Angel of Words podcast. So my first question to you is, you work in group insurance. What is group insurance? Because I've never really heard of that. I didn't have health care for 10 years before the ACA came out.
Well, first of all, I'm an account executive, right? So I'm responsible for servicing a block of business or accounts that have been assigned to me by my team lead. So I primarily support the HR team, the directors, the managers, the coordinators, but I also have to present to the C-suite of a company, the CFO, because even though, insurance or employee benefits may be a small portion of their overall, benefits or compensation package to some employers, but that affects their budget. So we assist with that. As a broker, we are the middleman between the healthcare partners, vendor partners, Blue Cross Blue Shield, United Healthcare, Cigna, Aetna, MetLife, and the employers. We shop for markets, we negotiate, we present, we manage the implementation, we put together communication materials and explain the benefits. So a big portion of what I do is support the HR team during, this is the time of the year, right, where employees are trying to determine what benefits are going to suit them for the following year. So we put together these packages and explain the benefits so they can make educated decisions on what's going to help them and their family for the upcoming year. This year is a bit challenging because of COVID, so we can't get in front of them, but, we're getting creative with, Zoom and WebEx and Microsoft Teams. But that's basically what it is. Group insurance is what it sounds like. It's a insurance coverage through an employer or a company that offers coverage for individuals in a group, which usually can be obtained in a cheaper way than insurance for an individual.
Now, one of my follow-ups is this only if you have a job? Like you have to have a job in order to get group insurance?
So that's what it is. If you are part of a group or an employer group, then that's what group insurance is.
Okay, and you work with multiple health insurance plans. It's not just one health insurance plan.
Correct. Yeah.
Okay, so they hire you to create a package and they have to sign off on that.
Yes, absolutely. So we present them. We're the middle people, right? So we shop for them and then we make our recommendations for the group, and then they determine which benefits they're going to offer to their employees and at what rate.
Okay, and by shopping for them, you mean that means that you go out and actually look for clients to work with the insurances that you're working with?
So no, we shop with the vendors, with the vendor
Okay.
partners. So like the Blue Cross, Blue Shield, United Healthcare, Cigna. Those are the ones that we shop for. Shop with, but we are shopping for our clients.
Okay. All right. That makes sense. Now, Ms. Riley, we also hear these jargon being thrown around and this word called, this phrase health savings account. That's very confusing to me. It's like, okay, you put money in an account, you use it for your health insurance. And if then it rolls over into the next year. Is that kind of what it is, or?
That's exactly what it is. It's a health savings account. It's an HSA. It's usually associated or, it's created for employees or individuals who are under a high deductible health plan. So it's a feature of that high deductible health plan or consumer driven health plan. It's got a triple tax advantage because whatever you contribute to it, whatever earnings or interest are in there, and anytime that you withdraw money for a qualified healthcare expense, those are all free. There is no use it or lose it. It's meant to be saved. So for the future, right? For any qualified healthcare expenses. That's why it's called a HSA, Health Savings Account. It's really a tool for retirement. But, if you have expenses, then you've got funds, those pre-tax funds that you put in there to use it. And if you don't have any expenses this year, it rolls over to the next year and it continues to accumulate for the following years. You don't lose it. It's your account.
Now, is that something you have to get through your health insurance provider, or is that something that you can start on your own?
No, so it's associated with the plan that you enroll with through your employer, that group insurance. So if your employer has elected a consumer-driven health plan or a high-deductible health plan, they're both basically the same thing, then that's a feature of it. Then you're able to open up an account to help you satisfy that deductible. Because usually with those consumer-driven health plans, they're also known as high deductible because they normally have a pretty high deductible that you have to satisfy. And so that HSA helps you pay for those expenses.
Now, what are the advantages of group insurance compared to people receiving insurance via the marketplaces in their respective states?
So there's a pros and cons to both, right? With group insurance, you are sharing the risk with a group. Your rates are based on your group. The pro is that your employer is offering you this plan, but they're also helping you pay for that plan. So they pay a portion and you pay a portion. The con is that you're limited to the plans that your employer has elected for you. So if they only want to offer one plan to employees, then that's your option. Under the marketplace, you do have options, but you are rated as an individual. So, when you go in to look at what's available for you, they ask you for your zip code, your gender, your age, your height, your weight, if you're a tobacco user, if you have any health conditions. So all of those factors affect the plans that they offer and the rates that, would apply to you. So again, pros and cons to both.
Now, do they actually send people out to do this risk assessment?
No,
do
you
they prove it? Like, how do they know if you're smoking or not? Like, you tell them no. How do they prove that you are? Like, I always wonder, like, do they send an investigator? Like, how does that work?
I don't know. You want to be honest when you're filling out those health questionnaires, for sure.
I mean, I guess.
What you don't want to do is risk having something not covered because you weren't honest with your original, question. So let's say you are a smoker, and then a year from now you're diagnosed with lung cancer, but you had said no, you are not a smoker. Well, they're gonna, question that.
Really? So now I have cancer, I have this insurance, and that, obviously they can prove that you probably had cancer because you're a smoker. You lied to them, and they won't cover you because you lied to them.
I'm not the insurance provider, but I can only assume that you're risking, having those services covered if you were not honest with your initial assessment.
Well, there you go, folks. Don't lie if you ever apply for a group insurance because it's not in your best interest. They may shut you down at your biggest time of need. Right now, we're speaking to Lori Riley, health benefits expert, the health benefits guru out in Dallas, Texas, but you work also all across the country, correct?
Yeah,
You
it
do
depends
give
on
like
where my
presentations
clients
around the
are.
country?
You
Yeah.
know, some of them are here in Texas, but, you know, they have locations all over the place. So in the past, I've done open enrollment meetings at their different locations. So I've seen you when I've
Okay.
done open enrollment meetings in New York.
Now, you spoke about this mystical thing called deductibles. People always are worried about deductibles and premiums and co-insurance. Could you break that down? Like, because every time I speak to someone, it's like I leave more confused than when I started the situation. Like, I wish I didn't even ask. Like, could you break that down, you know, what that really means in terms of like when you're dealing with your health insurance providers?
Absolutely. So a premium is what you pay for the plan, just to be covered under the plan. Once you are enrolled in that plan, then it just depends on the plan that's been elected for you. So for instance, if you do have a high deductible health plan, example, $1,200. And so you have to go see your doctor. Well, you go to an in-network provider to make sure that you're getting the contracted rate that they have, you know, contracted with the insurance vendor. You have to pay for that service up to satisfying that deductible. Once you have satisfied that, it could be between, you know, 2, 3, 4 visits, prescription drugs, anything related to that deductible. Once you have satisfied that deductible, then you have a co-insurance, what you co-share with the insurance vendor, and then you pay all that until you have satisfied an out-of-pocket maximum, your maximum liability for the plan that calendar year. And then, you know, some plans have copays. It's a set amount of what you pay to go see your doctor or go get a prescription. So it just depends on which plan your employer has selected for you.
Now, does the copay go towards your deductible or no?
Your copays will go towards your out-of-pocket maximum. So your deductibles, your co-insurance, your copays, all of that goes to your out-of-pocket maximum, your maximum liability for the plan year.
Now, are you allowed to use your health insurance if you haven't paid your deductible? Like, is it still gonna, like, how does that work?
Okay, I'm sorry. Repeat that question again.
No. If let's say you haven't satisfied your deductible on your plan, are you still allowed to use your health insurance?
Absolutely, yeah. You're paying the contracted rate until you satisfy your deductible.
Okay, so you're building up a bill until you satisfy, and then the
You
bigger
pay
benefits.
every time
Yeah.
that, you know, most doctors who are contracted with that healthcare vendor know how much your deductible is, and so they'll let you know, hey, Miss Riley, your visit today will be about $80 because you haven't quite satisfied your deductible yet.
Okay, what if your deductible is $4,500? You go to the doctor for the first time. It's a $5,000 situation. You have to come out of pocket $4,500.
Most doctors that are in work will only charge you a contracted rate. So, you know, that it depends on the region that you're at and what that contracted rate is. So it could range between $80 to $125. Now, if you have an emergency situation and you go to the doctor to the hospital and you go through the emergency room and you have to have surgery and all of that, then that deductible will be met pretty fast.
All right. That's great. That's great knowledge. Thank you so much. Now, there's other jargon that confuses people as well. PPO, HMO, what are these things and what's better?
So a PPO is a preferred provider organization. It allows members to go in and out of network. It gives you that balance, but it's really network. And, you know, especially if you live in the city, there's no reason for you to go out of network. It's way more expensive. So you will see that plans really encourage employees to go in network because that's where the less cost is. Those are providers who have contracted with that vendor to give you a great, it's a better cost for you. For employees, and usually the cost for for you to visit that doctor, there's a certain rate, and that's what that copay is associated with a PPO provider. Now, HMO, they're not as popular as they used to be, 15, 20 years ago because healthcare has increased so much in the last few years. But a HMO is a health maintenance organization. It basically limits coverage to those members to go to those in-network only providers. You don't have out-of-network option. Normally or typically, you have to get a referral to see a specialist. You don't have to get a referral to see a specialist under the PPO plan. Under the HMO, most likely you would have to get permission or a referral to go see a specialist. And so, those are the, again, pros and cons to both.
All right, so it seems like when you have an HMO, it's a little bit stricter and confined.
And the network is a lot smaller. But sometimes, depending on the area that you live, that may work really well for you.
Now, do people ever complain to you that an HMO sent them to a specialist that was out of network? Does that happen?
No, because HMO will only contract with those in-network providers.
Okay. So that's the practice that they should be upholding, sending people to people that are in their network.
Yeah, absolutely. So if a part of that HMO, then they should be recommending you to see a specialist within that HMO network as well. But always do your homework. Be a smart consumer.
Yeah, definitely. Always, be a smart consumer, everyone, because they will take, everybody's this is a business at the end of the day. So they're trying to make as much money as they can, Now, what happens to your group insurance and HSA if you leave your job or you get fired?
Okay. So if you're terminated, you typically have coverage until the end of the month with that plan. And then you have the option of electing COBRA, and then you have that about 18 months. Now, a lot of people don't elect COBRA because it's expensive. You are responsible now for the full amount of that premium, what the employer was paying, what you were paying plus 80% admin fee. So you're paying 102% of that plan every single month while you're on COBRA. So it's pretty expensive. So not a lot of people participate, but it's a great option if you have health conditions and you want to continue with that same plan. Your HSA, as I mentioned before, rolls over. It's your account. So if you leave a company or you're terminated, that money goes with you. It's your account. Some employers actually contribute into your HSA if you are, part of their high deductible health plan to help you, with those expenses. Whatever they contribute into that HSA is yours. So if you leave, you take the money. They don't ask for that money back.
And that money's in a personal account, I'm assuming.
Right.
Or,
it's
okay.
in
Wow.
your
Okay.
name. Mm-hmm.
Oh, wow. Okay. Well, that's nice. That's nice to know because you're going to need it with COBRA. COBRA is super expensive.
Right.
It's out of control with COBRA. A lot of people complain about COBRA. That's for sure. Now, are these health insurance options affected in the ACA? What if they're termed invalid and it's vacated by the government? What happens with the group insurance
So,
situation?
that's still up in the air. We don't know what's going to happen with the ACA. What we do know is that since the ACA went into effect about 10 years ago, a lot of companies have really thought about how, they treat their employees, what kind of benefits they offer the employees. So, there's been a lot of good things that have come out of the ACA. But we'll see.
Yeah, such as Could you discuss the benefits of the ACA for some people that don't quite know?
So there's been many. I'll just mention just a few of them. Like the first one would be it required employers with more than 50 employees to offer affordable health insurance to their employees who work at least 30 hours. So before full time was 40 hours. Now it's 30 hours. By affordable. They offer, employees, like, for example, in 2020, the employer has to offer at least one health plan whose premiums for employee-only coverage does not exceed 9.78% of their household income. So they have to make sure that they're providing affordable health care to their employees. They've eliminated the waiting period, or they've reduced the waiting period. Before, you can walk into an employer and they would make you wait, 90, 6 months, even a year to be eligible for health insurance. Now, because of the ACA, your waiting period is no more than 90 days. So you'll see a lot of employers saying, okay, first of the month after 30 days, first of the month after 60 days. So that's pretty typical. Preventive care. Everyone has preventive care, that once a year wellness checkup. So well man, well woman, well baby, well child, that once a year physical is covered at 100%. So there's no reason for people not to get at least that once a year checkup because it's covered. It's at no cost to you, no deductibles, no copay. It eliminated pre-existing conditions. So before, you would have to fill out a questionnaire, and sometimes they may even deny you because you had a pre-existing condition. That went away. If you work for a company that offers benefits to their employees, there's no discrimination if you had a pre-existing condition or not. Everyone is offered the same, pretty much at the same cost. And it allows children up to the age to be covered under their parents' plans up to the age of 26. So it doesn't matter if they're full-time students or working full-time or even living at home up to the age of 26. So that's what I tell all my kids. You have until 26 to get out.
Yeah, no, unfortunately, I didn't make that cut when they had Obamacare, so I had to figure things out,
Yeah. 26 is the cutoff.
I was already out the house by 26. I'm like, well, I'm not getting insurance. I'm done. It's over. I could have had Medicaid, but it's not happening for me. Now, talking about pre-existing conditions, are you able to acquire group insurance even though you have a pre-existing condition?
Yeah, so that's what the ACA did. It eliminated that pre-existing limitation. So now you're able to, be enrolled. So you don't have to even show proof that you've had previous coverage. You could just be enrolled in the same plan or be offered the same benefits that, your workmate who's pretty healthy and has no previous pre-existing conditions. Everybody gets offered the same thing.
Oh, that's fantastic. Now, in terms of like deductibles, co-insurance premiums, with group insurance, can this money be taken out of your paycheck? Is this something you have to, send in an envelope somewhere? You know how the mail situation isn't too valid nowadays, Been in hot water a lot lately, the postal service,
It is so delayed. No, so that's the beauty about, working for a company who offers health benefits like this, because those are all part of your payroll deductions. They make it very easy for you to have those coverage. And usually medical, dental, and vision and any contributions to your HSA, those are done on a pre-tax basis. So it makes your take home income a little bit more because, anytime that you contribute to it you pay for those coverages, they're done on a pre-tax basis.
Okay. Now, do these insurances cover vision and dental? Because, that's a big deal for a lot of people, and a lot of them, they want to get braces and things of that nature. But I've noticed that a lot of insurances don't cover cosmetic dental coverage. It's only like if you have like a severe situation health-wise.
Yeah, so again, it depends on the plan that your employer elected for their employees. So some employers offer, dental benefits that include orthodontia or, coverage for braces. Some employers don't. Some employers offer a vision plan that has LASIK coverage. Some employers just give you a discount. It just depends on what your employer, that group insurance, what's being offered to their employees. So it's not necessarily the vendor, right? It's not necessarily, MetLife doesn't cover this. It's the plan that your employer has selected for their employees. But yeah, cosmetic, teeth whitening, usually an exclusion. Botox, not a qualified healthcare expense, usually an exclusion. So, can't do it.
Now, there's this thing called open enrollment. I'm not really sure if a lot of people know exactly what that is or when it is. Could you discuss open enrollment for us?
So open enrollment can vary depending on the plan that your employer, has selected. So if most of my block of business, their benefits begin January 1st, right? So your benefits will begin January 1st. They're in effect for a full year. So typically around September, October, November timeframe, that's what that open enrollment season is. This is your once a year opportunity for you to look at the options that your employer is, providing for you or offering you. And you can either enroll or decline. If you elected, one plan this year, you didn't like how it was, and next year your employer's offering you two plans, then open enrollment is the opportunity for you to enroll or change your benefits. If you had a dependent that's no longer eligible, you can drop them. That's your once a year opportunity for you to elect, change, remove benefits. And then once you've made that election, then January 1st hits, you can't make any more changes unless you experience a qualified life event. Examples of that: marriage, divorce, birth or adoption of a child, death of a dependent, eligibility for Medicare, Medicaid. Those are qualified healthcare expenses. And then you have an allotted time, usually about 30 to 31 days, to notify HR that you had a change, and then they'll let you make a change. Otherwise, no changes to your benefits for the full year. Does that make sense?
No, that makes perfect sense. Now, in terms, essentially, it's the time frame that you have to do any changes that you want to make, or select what plan you want to go with, or decline any of the plans that are available to you.
Yeah, some employers are very flexible. Some of them are very generous with the time. Some of them just say, hey, you got 2 weeks to make a decision. Some of them say you got 3 or 4 weeks. It just depends on what the HR team decides for you.
Yeah. Now, in terms of insurance going from state to state, that's still not allowed, right? Can you take your group insurance from one state to another state if that state has the same insurer that's providing your coverage?
So again, that's what the in and out of network means. Like for example, Blue Cross Blue Shield, they have in-network providers throughout, nationwide. So let's say you live in the state of New York, but you have a child that's going to school in California. So they have insurance, in California, and they have in-network providers out in California. The way that the claim is processed may be delayed a little bit because they have to coordinate with the local, providers, but it's, that's what the beauty of in-network or even out-of-network benefits are.
Okay, that's beautiful. Now, you are the health insurance guru. You always been coming in and out of town, sis. And I always thought that was so baller. I was like, I wish I had a job like that. I would think, I'm like, man, I would love to travel this, from state to state and stay at these luxurious hotels and have a corporate credit card. Like, because, I love entertainment. It's my thing. It's what I'm doing right now. And, it's my passion. That's why I chose to go this route. But there's a lot of people out there, a lot of kids out there going to school or not going to school that don't really have a vision for their future right now. You've always been very headstrong, and, you ended up having this amazing job, and there's a lot of amazing jobs available in America, such as the one that you have. And I just want to know what made you get into this field, and could you provide a little bit of knowledge for people?
Yeah.
On this.
I sort of kind of stumbled on it. I started out in customer service. I'm bilingual, so I started out for Cigna Group Insurance 22 years ago. Providing support to people, who called in on customer service, but I'm also bilingual, so that helped in that aspect. And then from there, I went to processing claims and then supporting the sales team. And then when I realized, wait a second, I like, you and I are very much alike. We like talking to people. We like educating people. And so, when I went to the broker side about 10 years ago, that's what I wanted to do. That's what I actually really enjoy doing. Part of the doing these open enrollment meetings and getting out in front of people and seeing that light bulb go off, because I've helped them understand what is a deductible, what is a copay, how can you mix and match a plan that will benefit not just them, but their families as well. If they have 1 child or 5 children, what does this mean for how much is coming out of my paycheck? And so just helping people, both English or Spanish speaking, that's what I enjoy doing. And so that's why I've stuck with it for such a long time, because I actually think that it is an important subject, and I actually like it.
Oh,
I know insurance is not exciting, but I actually like it.
No, you seem real passionate about it. And like, everybody has different things that different quirks, things that interest them. Not everybody's interested in the same stuff. And,
right.
I just want, any, young adults out there looking for careers, looking for things that they're going to feel passionate about. Because I'm sure you didn't think you were going to feel as passionate about what you're doing as you do right now, and it's satisfying, isn't it? How do you feel about your job? Does it satisfy you? Does it
absolutely.
Get mentally and in every other respect? Yeah.
Yeah, absolutely. And, working for a company that provides the resources to help you do your job well, that's always important. So, what I would recommend telling people or, young people is interview them the way that they're interviewing you. Be curious about the benefits and the services and the support that they're going to provide you as much as what you're bringing to the table, because you want to make sure that, that's part of the interviewing process, right? With a company, is making sure that it's a good match both ways. And, find something that you enjoy doing and then get paid for it. That's awesome.
How's the pay over there? Is it nice? Because people want to know, Are you living well?
Are you living well? Top brokerage firms in Dallas, so I have no complaints.
So you're able to travel? Have you been to Italy finally? I know you've always wanted to go.
I did. I went last year.
There you go. What part did you go to?
Not work related. That was a vacation.
Oh, that's what I'm saying. You were able to go on vacation to Italy. I know you've always wanted to do that. It was a dream of yours. Were you able? Well, how long were you out there for? How fun was that?
So we did Paris, France for 1 week, and Italy another week. So it was a nice 2-week break.
Did you ever think that coming from the projects, you'll be able to go see Italy and Rome and places of that nature growing up?
Absolutely not.
Because, by the way, my sister grew up in the Peace too, baby. She got out of there early,
I'm a true New Yorker. I went from New York to Puerto Rico, and then here I am in Texas.
We could always become classy when we want to. You know what I'm saying? There's no excuse. Well, sis, it's about that time, though, on the podcast where we're going to play 5 Words with Angel. Now, sis, on 5 Words with Angel, I'm going to give you 5 words or phrases. You're going to give me the first phrase that comes to your head, okay? Or the first word. Are you ready?
Ready.
All right. The first word is group insurance.
Inexpensive, sometimes.
Nice. I like that. The second word is open enrollment.
Very busy time for me.
The third word is deductibles.
Yeah. A high deductible can also mean smart consumerism.
Nice. The fourth word is the Affordable Care Act / OBAMACARE.
It has some good qualities to it.
Now, the fifth word is a curveball. The fifth word is always the curveball. New York City sports franchises.
A little disappointing recently.
That is a fact of life. It's very frustrating. And that's how I'm going to leave it right now.
Especially when I'm married to somebody who's from Texas and all he wants to do is brag about Dallas, which I think that's even better.
And it's like they stink, but we stink even more. I never would have thought I'd see that, man. It's so frustrating. I'll have a podcast down the line, folks, discussing football. Right now is not the time. I'm just not feeling it. I don't want to go on a rant.
Your frustration.
Yeah. Now, sis, before we wrap up the podcast, could you, first of all, could you say a little something in Spanish for the people that don't speak English, about insurance, like a little summary of like everything that you just said, something 6 sentences or something like that, just to keep them, like, not to make them feel scared of like this whole health insurance thing.
Yeah. Miedo, va a haber oportunidad para mirar a sus opciones. Y si tienen un plan que no entienden, hablen con su departamento de recursos humanos, si está disponible, para que puedan entender cómo usar sus planes, sus beneficios. Porque no queremos que solamente piensen que, no entiendo y no lo voy a usar. No, está ahí para que lo use, pero úselo bien. Entonces, edúquese para poder usar sus beneficios apropiadamente.
Oh, that was lovely. Now, sis, where could any of the people that are listening and watching actually contact you if they have any questions, or they feel like they want your services? Or do you have a LinkedIn account or something that people
I
could reach
do.
out to you
Lori
at?
Riley, LinkedIn. Yep. Lori Riley.
Okay, you could reach out to, Big Middle Sis at, Lori Riley on LinkedIn, and she'll try to navigate you through the tough times of open enrollment, but actually don't even try to hit her up on open enrollment. You're probably too busy to answer LinkedIn messages. You may need an assistant to do
Anytime
that
after
for you.
December, I'm good.
Now, a message to all the young adults out there, looking for careers and not being sure about, where they're at in life. Could you, just give them a little message of your trials and tribulations and how you feel about where you are in life right now?
Yeah. Get educated, find your passion, and have fun. I mean, and again, like I mentioned, interview your prospects the way that they're going to be interviewing. Interview them the way they're going to interview you. Come prepared. Do your research on the company that you're interviewing with, and find out about them and see if this is somebody that, a company that you want to start off small but then grow with, right? And just, enjoy the process of finding the right match for you. But, work hard, because you need to prove yourself too. Everyone needs to just work hard and prove themselves. But, there's great opportunities out there. You just have to find the right place to work at.
Now, sis, I must say I'm, as a person that's grown up, looking up to you and all your successes and the things that you've been through, I am very proud to say that, you are related to me. You're one of my shining beacons, one of my queens in life. And I really appreciate you taking your time out to explain to us, what's happening with this health insurance situation, because 20 million Americans may be affected by this. And not, and not only that, life is hard, and we've come from some tough backgrounds, and the fact that you've been able to overcome and become a successful businesswoman is something that I want every little young girl and young boy that's coming from where we come from to aspire to, and and reach those goals. And I'm very proud of you. You're a great human being. Always have great energy. Your energy is always positive, and it's something that honestly rubs off on me, because I try to be that way myself. And if I haven't told you this, you are one of my role models in life, okay? And I'm very grateful to have you in my life, and thank you so much for being a part of my movement and the Angel of Words podcast. It means a lot to me.
Well, I'm very proud of you. I think that, what's helped me along the way is trying to find a work-life balance. I love what I do at work, but this job actually allows me to have a life outside of it. So, I'm married, I have children, I want to spend time with them. And so that's something that I'm very firm in my belief that, you have to have a balance in your life to maintain, everything around you healthy, your physical and your mental well-being. And so those are very important. So thank you for giving me this opportunity to talk about, what I do. But, I'm so proud of you too. I think that what you're doing is awesome. I think that we're so much alike because we like to educate people, and that's what you've been doing, and you've been kicking booty for that. So thank you for giving me this opportunity and this platform. But I'm just equally proud of you. Mwah.
Kisses, you know more about health insurance than anybody I know, and I know a lot of people in that field. And that was Miss Lori M. Riley on the Angel of Words podcast. Thank you so much, and we will talk to you soon. Hey everyone, I hope you enjoyed my interview today with my big middle sister, Miss Lori Marie Riley, the healthcare guru. And I hope she was able to give you some good information on how to get the best healthcare coverage just in case you lose your healthcare coverage moving forward. Now, folks, you can follow me on Angel of Words Entertainment on YouTube. Don't forget to click on that notification bell. And you could also follow us on Spotify, Apple Podcasts, and wherever you get your podcasts. And if you want to know what I'm up to on my social medias, just follow me at Angel of Words ENT. Thank you for tuning in, everyone. Talk to you later.